Welcome back as we continue our Conversations on the Couch series brought to you by GenesisCare. I'm Lindsay Morton, and today I'm joined by Dr. Fia Yi, who is a colorectal surgeon, and we're talking about robotic colorectal surgery. And this is very interesting because I know this is something patients have a lot of questions about. So just to get the ball rolling, what exactly is this type of surgery?
So robotic surgery is very similar to laparoscopic surgery. I find it's the next evolution in minimally invasive techniques. So we use the same small incisions, but this time we use an actual robot that is docked at the patient's bedside, and I'm sitting at a booth controlling that robot in the room and performing the operation itself.
Interesting. Now, you kind of explained that it was similar to laparoscopic surgery, but how is it different?
So some of the differences include how the actual instruments work in the robot. So with standard laparoscopic surgery, the instruments are very straight and they don't move or rotate. So it's really up, down, left, right motion, which kind of limits the ergonomics of performing operations, especially in very tight spaces. And for example, we operate deep in the pelvis often, and so with robotic surgery, they've instrumented their device where it actually operates under the engineering term of 7 degrees of freedom. So the actual instruments actually move like your wrists do. So it's like having my hands miniaturized inside the abdomen, and I can do much more precise and technical work.
Very interesting. Now, would there ever be a situation where a patient does not qualify for this type of surgery?
Absolutely. So very similarly, when we do minimally invasive surgery, this relies on the abdomen being free of a lot of adhesions. Now, we have done operations on patients who've had prior operations, but for example, if a patient has had multiple operations, then it might get risky to try to do this minimally invasive. We'll always try, but I will oftentimes tell the patients that we may have to convert to an open procedure. So I'd say yes, but it depends.
Now, I know our goal is to always try to keep our patients close to home anytime they have to have a procedure of any kind. Where could a patient go if they needed to have this type of surgery?
So I'm here in Fort Myers, and the robots here are at Gulf Coast Hospital as well as Health Park, which I operate at both hospitals.
Excellent. Well, thank you so much for your time today.
Thank you.
We want to thank you all for tuning in and joining us. We'll see you next time as we continue our discussion of Conversations on the Couch.